Hi there, I'm Dr. Chung and welcome to your friendly proctologist. On this channel we discuss the health of our bottom ends, and I hope you can learn something or learn a thing or two. Today I want to talk about external skin tags, external hemorrhoidal skin tags they might be called, or just skin tags. What are those extra pieces of flimsy skin stuff that's hanging out on the outside? And I want to kind of enlighten you as to what those are, where do they come from, and why don't they go away? What's the deal? So the first thing is external skin tags come from the external hemorrhoids. Makes sense, right? And we know that because the covering of the skin tag is the same as the skin from the outside of our anus, right? So the color of the skin looks like the skin on the outside. It's not shiny and wet or pink, because that would mean it was from the inside of our anus. And typically they don't make things more wet, right? Because they're not from the inside, they're just a skin covering. But they can certainly be distracting or distressing, because sometimes just the sight of them makes some people really anxious and really hate the way they look. They can become very self-conscious of that extra skin tag, and they just get really embarrassed. I mean, that's probably the biggest complaint, or the biggest, most common reason for removing those, definitely, is because they just don't like that thing. It messes with their head. The other thing about the skin tag is that it's usually soft, very flimsy, and it can just flop around to and fro, and hygiene becomes very difficult, especially when you have a softer stool. It can get caught in the folds, and it can require multiple wipings, right? You know, and sometimes people bring the wet wipes, because otherwise the job doesn't get done. They're grossed out. You feel like you're not clean, and you can't go out because it's always getting in the way. So it comes from the external hemorrhoid, and when your hemorrhoids, the blood vessels on the outside, get irritated, they flare up, right? Well, the hemorrhoid blood vessels also get bigger, but so does the skin around the hemorrhoids as well. And that's where the beginning of these hemorrhoids start. Because when you keep attacking those hemorrhoids because of whatever reason, like hard poops or straining or what have you, then these guys will continuously, over time, get bigger and bigger and bigger. And one thing about hemorrhoids that we know is that they never go back to their original size. Once they heal and the inflammation goes away, whatever they calm back down to or settle at is their new size. And so again, it's very important to develop that routine so that we can take care of our bottom ends. But these hemorrhoid skin tags can be doomed to just sit there and be liable to get bigger. And so what can we do about these then, right? Well, when it's flared up, definitely ointments or things to calm your bottom end down, like sitz baths and relaxation, are one of the first things you can do. And then the next thing would be to see a surgeon about it, because to have these things removed, the only way to do that is by doing a procedure to actually cut them out. Usually it's something that can be done in the office setting. I've done many in the office setting, but if they have the size big enough, sometimes doing it in the surgery or doing it in a surgery in the operating room would be the best and safest situation for you. So I hope that this video helps you give a little introduction to those pesky extra flaps of skin on the outside, and gives you some knowledge about them, so you're more confident and you know a little bit about how to take care of them and who to go see if they ever do bother you. So I hope you have a good day. Please like and subscribe and ring that bell, and I'll bring you more videos which are coming up soon. Take care. Bye bye.